So, talking about teaching plans, I'm going to show you the easiest way to find a teaching plan is to go to our RISE website. I think this is much easier to navigate than WIDS personally, but it is also on WIDS. The thing to remember is when you go to the home page, which I'm not going to back out right now because I'm signed in, but up here at the top there's a place to log in. So in order to find these teaching plans, you have to log in and set up an account. And then once you set up an account, you have access to all these different teaching plans. So by clicking here on teaching plans at the top, you'll see you can filter by discipline. So if I only wanted to see the nursing ones, for example, here's the nursing organized by storyline and levels. There's also student handouts provided, which are basically the scan to start code and a little bit of a scenario overview. You can use that to start making your own prep sheets or discussion guides or worksheets. If I wanted to see respiratory therapy, then just click on that discipline, same thing, you can go down. We also have them organized by whether it's a case study, a serious game, or a simulation. And you'll see, like Teresa said, most of our things that are published are simulations. There's other resources out here too. We have various videos. This video today will be posted out there for people that want some training. There's also some demos. One of these demos we're actually going to show today. Kind of the overview like we've talked about for this first hour. There's some webinars if you want to see our webinars. There's some blogs. There's help questions that Charles has helped make messages about updating your iPads and things like that. So this is a really good resource. WIDS, if you do want to go out to WIDS, the thing to remember is you're going to click on the WTS repository login here. Once you're there in the repository, you're going to search for ARISE. Now there's two more steps, and this is where people tend to get lost, including me when I first started doing it. You have to click on ARISE, and then up here at the top, see Documents. And click there. And then once you're there, you're like, well, where are the documents? You have to go over here on the left and click on Share Documents.
Yeah.
That's why I fled, right, Sarah, for the website.
And
please.
That process of getting into WIDS and finding them there is some documentation on our project website as how you get in with all those steps.
We do recommend if you're using this, maybe have your simulation tech or a point of contact, continually check these for updates because as we run through things, as people pilot things, we might be, there might find a typo or there might be something that's fixed here and there. So these contain all the most up-to-date scenarios that way. Same thing with the website, they both do.
By the end of the project, by the time we're done, we'll probably send out a big mass email to everybody on the website and then everybody that's associated with the tax grants, let them know that we have now updated and these are our final copies. We're just going through things. We produce these so fast sometimes that even though we all look at them 100 times, we found typos and there's little things that are wrong here and there that we have to go back and kind of edit a little bit. So we know that there'll be final copies later. So even if you make copies now or download them now, you're probably going to want at the end of the grant go back and just save them over again once you download them. Because once you get into WIDS, you can save these wherever you want. You can keep them in your own files. You can do whatever you want with them once you download them. But I would recommend later on, we'll probably fix or we'll try to find it. If you do find errors, please let us know because we'd love to fix them.
So you should have a copy of this teaching plan in here in front of you. And so we thought we'd just kind of walk through and show you how to navigate the teaching plan first. At the top is always the discipline, the level, and then kind of the basic skill focus. We've estimated about how long it will take to run through this scenario and about how long it takes to run through the debriefing. And this is your most important piece, is your scan to begin QR code. It will list the patient name, a little bit of an overview of what's happening during the scenario. Next page are the specific learning objectives, and according to NACSO best practices, when you do your pre-briefing, we have some prompts I'll show you here in a second, but you always want to run through the specific learning objectives for the students at the beginning of the session, as well as provide it to them ahead of time. So sometimes we make these very purposefully vague, so the students don't know exactly what they're going to be encountering other than some basic things about the storyline. And other times we make them very specific, usually in some of the lower levels. This is the curriculum mapping that we were talking about. This is for respiratory therapy, so it shows the program outcomes, the different courses, and the course competencies that tie into this scenario. Nursing would have the same thing. So we're going to page through those. Next page, this section is really for the simulation technician, so you know how to set up the environment, what if the patient should be wearing something, what should be inside the room, outside the room, the basic demographic information. I know our sim tech likes to have this right in front of her, so she always knows the date of birth, the age, things like that as she's going through the scenario. Next section is the equipment that you'll need to set up. Again, how is the patient dressed? Is there a monitor or not? If there's a monitor, what are the vitals showing, or what should the students be finding? In some of these especially level 1, the vital signs are checked against these parameters so that you know as a facilitator that if a student gets the wrong vital sign, that it's going to tell them, please check your vitals again. The different supplies that are needed for this scenario, whether it's equipment or medications. We'll talk about medications in a little bit, but you'll see there's QR codes for the different medications that can be scanned, and that's where we're simulating the environment in a hospital where, whether it's like we call it Care Mobile device or a rover, in practice where you have to scan the patient's armband and then scan the medication, and that check is going on. That's what we have tried to mirror with the QR code. So when we have medications listed here, I just wanted to let the Syntex know that it's up to you if you want to actually have the medication available with the QR code attached, or if you just want to use the QR code. Because when they scan the QR code, they're going to see a label. If it's an IV bag, they're going to see an IV bag, and they're going to have to do the math calculations off the information they get off the IV bag. So it's up to you. Our technician likes to have the medication set up with the label and then have the QR code in addition to it.
And I actually have, we're going to be practicing a scenario later, but I just put the QR code right on one of the meds that we used. It's an easy way to do it, but it'll pop up with the label and everything like it should be.
The next page are the various QR codes. Now, some of these are kind of FYI, if like Teresa was saying, you want to make your own type of scenario and maybe just pull pieces out of it. Some of them are definitely needed. So we always, again, have the start code. That's the same as the scan to start. Some people like to put this in the room. So once the students go into the room, they're scanning to start. We like to have it as part of pre-brief so that we can do some discussion. And we're going to model that for you here in a second. The patient video, the report video, that's how we get to that. So those are just kind of FYI if you want to use them separately. Patient ID, just like a patient bracelet. When students scan that, they're going to get the patient's name, birth date, medical record number. And we do a lot of XX. So that, you can tailor it to whatever year you're in and to make him however old, 78 years old or whatever we decided to do. So you'll have to do some calculations before the scenario starts to know what their year is. These are some different, we're going to walk through this one, so I'm not going to explain everything here, but these are some of the different videos that are part of this scenario with the patient using an MDI or a DPI or a peak flow. And then these are those medication QR codes, like I said. In our later scenarios here, the pediatric asthma and the heart failure, this is where we've implemented our latest creative development, which is the anatomically correct lung sounds. We're going to show you those on Oscars here in a second, but I'll let Teresa talk about this because this was actually her idea, and I think it's a really good idea.
That was really important for us. I think it's really important to be able to listen to the lung sounds accurately. If we're supposed to model in simulation what we're going to do in practice, we can't always tell them to go in and find the certain spots where the lung sounds are. So I thought it was really important that we made sure that we had fairly accurate anatomical locations. So we picked 4 spots on the front, 4 spots on the back, and there are 2 axillary sites, which was more than enough. We couldn't do many more than that. Otherwise, when the iPad sees a QR code, it's going to scan wherever it is. So we had to be really cognizant of that. The other thing we did in order to maybe differentiate the sounds a little bit better is these are all foldable. So they're foldable and placed on the patient's chest in the right area so that when they open it up, they can actually see that it's in the right spot. But in that way, when you're in the room, the iPad doesn't catch the other ones by accident and accidentally scan the wrong one. The other thing we've implemented is when they do scan that QR code and they hear that sound, they're also going to see a picture of the actual patient's chest. So our patient that we use in the video, we have his chest and the stethoscope actually sitting on it, so you can see what the actual patient would look like in that anatomical location that you're listening to at that point. So on the posterior sides as well, you can actually see it all the way through.
So for technicians, you can see the little blue dots tell you where to place this QR code. Within the teaching plans, then we'll tell the facilitator, I'll show you here in a second.
We'll tell them, like, anterior, the lower two, and we'll say anterior, let's say 6 and 7 have crackles, and the upper ones are clear. We'll kind of lay out exactly what you can hear in each state, and then if they change from state to state, we'll say now all the breath sounds are clear because of this and this, and so it'll lay it out. So when you go from state to state, the actual assessment values do change.
I have a question.
Uh-huh.
What do you do with the posterior ones? Because I know some of the mannequins we're not really going to be flipping them over and listening to their back.
Well, we try to flip them enough to kind of get in there. So, even on our heavy stand, we'll rotate, you can rotate them enough to kind of slip it in there and at least try to scan the iPad as best you can. And usually you can get them over enough to kind of get to where you gotta go. So we just do the best we can with the mannequins that are there. And, we all know we have those heavy patients too. I just have to, try to put them in a spot that's easy enough to scan, but at the same time, you should be able to roll just enough to get to them to where you can see what's going on. Same thing with some of our wound QR codes. Sometimes you'll have a wound on your sacrum, and you'll have to be able to get and roll it over enough to scan that as well. I'm actually in a video up here where I demonstrate doing that. It's just a matter of rolling them just enough. And usually, we haven't had any problems with it. We can usually do it. It's just putting it towards the outside rather than the inside so the iPad can reach in and kind of get a picture of it. It kind of takes some time to get it in there sometimes, but you can do it.
And if you absolutely can't, it's a QR code, so then you
Stick
stick
it on
it
the
to
side.
the table.
Yeah.
Exactly.
And the picture will show up, so it will show up and say you have just scanned, and it'll show the back of the patient. So it's actually easy there. And later on, we're going to play a little bit with these, but we actually have a back. He has a back side too, so we can put them on the back side so they can actually, flip it and get those parts of it as well.
Okay, so now we're actually to the teaching plan part for the facilitator. And I can't stress enough, we get a lot of questions about this. You have to follow the teaching plan or you will get stuck in some of these scenarios because some of the QR codes are tied to students doing certain things in order to progress to state 2. So a lot of times we'll get calls, I'm stuck in state 1, I can't get past state 1. Did you follow the teaching plan where it says you have to scan the facilitator? Oh, that's why you're stuck in state 1.
Yeah, there's a little bit of a learning curve with this. That's one of the limitations, that there's a slight learning curve. This is not something you can pick up and just say, I'm gonna do it in the next hour. You really gotta walk through it. That's why we have highlighters around. As we walk through, we're gonna do a demonstration after break. As we walk through, we're gonna tell you how we highlight it, what we do, so we can kind of cue ourselves even while we're doing it. Oh, that's right, we gotta make sure this happens or the iPad won't advance. All it has to do with the programming, we'll kind of show you how to do it. You definitely have to have the teaching plan in front of you for sure. And we mark it, you use little arrows to use, and I've got highlights, and we all have our own little methods by how we know what's going on.
So we'll show you our little tips and tricks.
Yes.
The other thing I want to mention too, when you download ARIS you have ARIS on your iPad, you can search for Arise and you'll see a lot of different scenarios pop up that way, and some people get into it that way. But it's better to do the scan to begin. Maybe Charles can explain the why it's better to do the scan to begin than searching for the
Well, it's
Arise.
just easier. It's just an easier way to start the scenario.
And there's over 100 Arise scenarios so far, and there will be 150. Just scan to begin off that teaching plan. It gets you right to what you're looking for sure.
So scan to begin, and like we said, the way we do this, and I don't know if we have a video of that actually. We have a separate conference room with a large screen, large monitor, and so we'll scan to begin while we're there with all the students, and we'll show you here as we go. But that's a way to watch the RN video, watch the patient video, do some questions, talk through how to use the iPad. So we found that works really well. So you're going to meet your patient, you're going to be explaining to the students how to use the iPad scanner, and you'll see the students pick up on this faster than we do usually. They're in there tapping and swiping and yeah. they get it very quickly. Sometimes you want to tell them where the QR codes, other times like the sacral wound that Teresa mentioned, I purposely don't tell them about that one because I want to see them do a complete head to toe and skin assessment as part of it, and if they don't, then they won't find the QR code, and that's another teaching point that we'll bring up about how important that is. You can show them how to use the chest QR codes like we just showed you. And like I said, the programming is tied to these QR codes. The Level Up tab will show you as we go how that kind of helps you as a facilitator see where the students are too, if you can see the Level Up tab. Medication QR codes we already talked about. Oh, we didn't talk about the MAR hyperlinks. Do you want to talk about the MAR hyperlinks?
How about we save that for when we actually get into the demo,
To do
just
it?
to make sure that we're kind of staying on target with the
Okay.
time here.
Just keep in mind, you can always access med information. So getting report, watching the video, and then we always list some questions that the facilitator can ask the students as you go. It's up to you if you want to use these or use your own, but it's just kind of a way to get started. At that point, we recommend that you give the students a chance, for most scenarios, to be able to look through the iPad, look at the different chart forms, look at the orders, look at the MAR, look at the diagnostics, before they actually go in and care for the patient. Once you get through pre-brief, then this is going to show the facilitator, and this is why these teaching plans are so long, because we wanted to show the facilitator exactly what the students are seeing in each stage. It's also your backup. If Wi-Fi goes down, something happens, and you can't use the iPad, you have all the information you need to finish out the scenario here on paper. So this is just going through the different tabs that the students will have on the iPad and showing you what they see in each state. Orders, MAR, a daily record that includes various vital signs throughout the day. And you'll see a lot of times we use this instead of actual time so that you can model this to whatever time you're actually running your scenario. It was today and it was 3 hours ago, instead of putting a date, on a specific time. We have progress notes in a lot of our different scenarios. At this point, this one doesn't have labs or imaging available, but it will come up in a later state possibly. We do a lot of patient education as part of our scenarios, and these are all also open educational resources. The images, the text, everything is available for you to use in whatever way you'd like. So not only are they on the iPad, but you'll see at the end of your teaching plan, we always include the written copies. So if you want to make copies of those and actually have them in hand as part of the scenario or part of your classroom, you have them available for you. The last couple of tabs you'll see are the level, the scanner, and the exit. And we have it specifically set up so that if a student wants to exit before we've reached the end and they've completed all the objectives that we have put into place, it will tell you, are you sure you want to exit? All data will be lost. They can still exit, that's fine, but they won't be able to go back and see anything that they've saved at that point.
This is really a way to allow the facilitator as well, like, we got this far, I just want to be done right now. And it's a way for you to exit out as well before the time is up.
And I'm glad Teresa said that too, because you don't have to go through all these states. You, as a facilitator, you might say, state's 1, all I want to do, or I'm going to skip through state 1, scan the facilitator, go right into state 2. It's set up for your flexibility. So state 1 in our mind is when they're actually entering the room and taking care of the patient now. So it gives you an overview, it gives a list of the expected student behaviors that you want to be observing while they're in there, what QR codes they should be scanning.
This is right here, you see all the questions here, this is for your technician. So we put a lot of questions that you might, like the student might ask the patient and the responses back to it, so you get an idea of what we expect the patient to be feeling at that point and what the answers may be. It's a good time for the technician to go through and look at those answers and what we kind of think the patient should be doing at that time. It kind of gives some suggested answers for that. And there's a lot of questions here because, hopefully they're asking a lot of questions.
This level really focused on assessment and patient history, so there's a lot of questions in this particular scenario. So I'm going to just keep rolling down through here.
We always include some possible facilitator questions towards the end, and that's just some ideas as to what you may talk about with your students if you choose to, question them during the scenario or not. Just some ideas, it's things that we pulled out, but it's definitely not all inclusive by any means. And then the really important part of the teaching plan when you get here is this one section here where it says tab, iPad, prompts, and content. This part here is going to tell you how to advance to the next state in the scenario. That's the part where we're going to show you how to highlight, mark it, this is what I have to do. If I don't do these steps, I will be stuck here forever. It will never go forward. So these are the parts you're going to concentrate on. And then it kind of tells you how it changes from there, how the tabs will change and what happens. And then it's just the same thing. It runs through every single state. It allows you to know what happens in every single state as you go. And at the very end, again, it tells you how to get to the next state if there is one. Some of our different levels have 4 states. Some have 1, some have 2. It all depends on if we're meeting the objectives of that scenario and how we do it in each of the storylines.
And then the last important part of the teaching plan is the debrief. We know within Excel standards, the debrief is just as or more important than what they're actually doing in the sim lab. So you want to plan plenty of time for the debrief. The current standard using Dryer First method of debriefing is you want to start with letting them vent. Get rid of the emotions that they felt during the scenario. They might be frustrated, they might be anxious, they might be excited. You have to let them vent that for a few minutes before you delve into understanding of the learning objectives. It's kind of the RUST method, if that helps you remember: reaction, understanding, summary, and then takeaway points. So that's how we've set these up. So what's the reaction? And then understanding the different learning objectives that were at the beginning of this scenario. We've included some suggested facilitator questions within each learning objective. Again, it's up to you what you want to cover, what you don't want to cover. And then at the end, after you go through all the different learning objectives, one of the best practices for the facilitator to just use a sentence or two and do a brief summary of what occurred. So today you cared for a pediatric patient who was being discharged, experiencing moderate exacerbation of asthma. What is one thing you learned from participating in this that you'll take home? So it's a summary and a takeaway. And then have each student share one thing that they learned, and it has to be different from anything that anyone else shared. After that, there is a survey. We do still would love to have you, faculty or students, please fill out these surveys at the end of each scenario as you run it. And I'll show you some of the data that we have to this point, but that's what gives us feedback as we finalize these last scenarios.
We did include the QR code right there because normally in the scenario you're using one iPad for an entire group, but all students need to do that eval. So we include that there so you could use multiple of the iPads at that point and have them just scan that QR code, and we'll take them right to the survey link so every student can participate, every faculty member can participate.
Finally, here are all these handouts I mentioned that are contained in the various appendices.
So I think at this point, I think the best, we've kind of gone through the teaching plan, you kind of get a gist of it. So I think right now we're going to take a break. We'll take 15 minutes. We're going to come back. What I'd like you guys to be thinking about is now that we've kind of gone through the teaching plan a little bit, we're going to do a demonstration up front. And we're going to do a demonstration up front, and I'm going to ask for volunteers. I'm going to want at least one respiratory therapist, at least one nurse, one paramedic, and then we're going to ask for maybe a couple other. And we're going to facilitate this and guide you through the process and kind of show you how we run the scenario and what we would do. So just kind of be thinking about that so we can have a couple people up front. We're just going to run through this quickly, and this will allow you on your teaching plans to highlight, to make notes, to figure out what you're doing, and to kind of go through that teaching plan all the way through. We did choose the respiratory therapy scenario because it's easy, this one happens to be. I think it ties into all disciplines pretty well, being as though it's a common respiratory case. And even though it's something you're marking up later, you'll be able to apply this to whatever teaching plan we do in groups later, because then we're going to divide you out in specific disciplines later and give you another teaching plan to practice on your own.
So it's 9:05. Let's take a 15-minute break and come back in at 9:20. Get started with our demo.
Get started. Before we do the demonstration up front, we're going to show you one quick video. This is a video actually of me. I just kind of, we took the sound up, but it's me just walking through, kind of showing the experience of what a student might have. I wore a GoPro on my head and, did all of that. Just kind of guiding you through what's actually happening. The biggest part of the ARISE scenarios that we want to stress most of all is this is not all about the iPad. Your simulations should run as they always do The iPad is just a tool that we use to enhance the simulation. So they should be going in and doing everything as they normally would. They just use the iPad from time to time if they decide to scan a QR code or an order comes up or something happens. Otherwise, it's no different than having a bedside computer. They should be checking it when needed, scanning an arm code when needed, but it's still all about what you normally do in a simulation. So,
We're gonna actually pause here for a
I'm
minute.
super
oh,
sorry.
sorry.
I just wanted, we have the fabulous opportunity at the West Bend campus to have 3 of our administrators who are typically in the Fond du Lac campus. They were here for the West Bend campus forum. And I just wanted to have a quick shout out to them. Our president, Bonnie Barrowald, is here.
Good morning, everyone.
She's told her what exciting stuff we're doing. And then Jim Eden, the vice president of academics.
Good morning, everyone.
And then we're lucky enough to have a brand new vice president of student services, Jim Barrett.
Good morning.
You are more than welcome to stay as long as you'd like. This is amazing stuff.
Welcome, guys. Come on in. We need a couple people to demonstrate.
I only have 5 minutes.
Busy, busy, and academics. Busy, busy, busy. But student services, I don't think those guys are that busy.
Wow.
Okay. So we're just gonna move right on to the video right now. So we'll kind of walk you through this a little bit. So there's no audio. This is basically, we've already gone through pre-brief, and this is me going in to see my patient. I'm actually playing a nurse in this one. Trying to anyways.
So we still expect the same things where they're introducing themselves, checking patient ID, all the normal things that they do as you're walking into the room.
So I had her say her name and date of birth. I checked it with the ID band. And you'll notice I do have mom sitting over in another chair there, so this one actually has a mom. We just blew up the mom's face and put it on there to make it a little more realistic. And the mom QR code is actually covering her trach hole, just so you know on that. And that's actually a video. It's hard to see on the screen right now. That's actually a video of the mom. That mom talking to the patient and saying what she's thinking at this moment. So it's actually a patient, talking to the patient and kind of going through that scenario. So I've addressed both the patient and the mom at this point.
And the student, we didn't take time to do this, but the student will be providing therapeutic communication while they're going through and doing their assessments, which is always a kind of a difficult task for our newer first semester students especially.
That's a little dizzy. And I'm just kind of running through things. This might not be exactly how it goes, but we wanted to give just a quick demonstration. So I'm just going to assess my patient. At this point, I'm actually talking. I'm going to talk to her when I'm done listening to her, ask her a couple of questions here and there, and she's kind of moaning off and on, complaining that she's having a little bit of pain.
So she's complaining that she has pain on her back. So this demonstrates how Teresa was talking about trying to turn the patient at the same time while you're
I did this by
scanning QR
myself, by the
codes.
way. I just want to point that out there. So I moved through and I got her over. I go to assess her backside and I do see that there's a QR code, so that's my cue to grab the iPad. And when you're it does take a little bit when you're on anything on the posterior side, because the iPad does have to read it, so it does take just a second. But once you get it, you can see she's got a pretty good pressure ulcer on her sacrum there. I can put her back and do that, and then I have the iPad picture to kind of assess and look at and kind of take a peek at after I put her back and kind of get her where she's got to go.
One thing we've learned since as we were doing this is we are putting monitors in the different rooms so that whatever's displaying on the iPad is on a bigger monitor using an Apple TV or Air server, so that if you have student observers staying outside the door, they're watching the student doing it, they can see the pressure ulcer, they can see what the chart forms are, etc.
So now what I'm basically doing, we've seen the pressure ulcer, she's having pain. I'm going to go see what she has for pain in the chart, get the pain medications. If we walk through this extensively, we'll notice that she really doesn't have adequate pain control, and I'm actually going to call the doctor regarding this, so that's why we're by the phone. This kind of gives you just I think we can pretty much be done now. But this just kind of gives you a sense of what the students would be doing. Now, I did this individually, but like I said, none of us usually can do individual students in HPS, so there's usually a group involved. So, you know, we can kind of go through in groups. One person has the iPad, we never bring more than one in. That is just more than what people can usually handle. And you start to get that noise in several different spots, and nobody's in the same spot in there. So one iPad per group is the way to do this. Like I said, the way for facilitators to see what's going on is really to have it projected on a screen somewhere else with the Apple TV or some other device so you can actually see what's happening. And other students can as well, so you kind of know what's going on. So that's what really helps the scenarios go forward.